Hello everyone, my name is Melinda and I'm a reference librarian here at the Blount County Public Library in Maryville, Tennessee. I am delighted to welcome you to our program today, Medicare and Part D. This is the third in our 2022-2023 Focus on Senior series, which the library co-sponsors in conjunction with our wonderful partners at the Blount County Community Action Agency Office on Aging. As many of you know, we actually held an in-person event on Medicare and Part D here at the library very recently, along with program counselors from the State Health Insurance Assistance Program, or SHIP. I would like to thank Teresa O'Mary, the Director of the Office on Aging, as well as Amanda and Elizabeth and Malcolm from SHIP for all their tremendous help in organizing and presenting that program, as well as assisting patrons with their individual questions. For those who missed that in-person presentation, though, or who may simply want a second chance to hear that information, our longtime friend and ally, Joani Shaver, has been kind enough to agree to do this recording for us to post online. Many of you may recognize Joani as the former director of the Office on Aging. Earlier this year, she went into semi-retirement, but she now serves as the Safer Homes Program Manager. And we are delighted that she is still working with us, and thank you for your help, past and present. And I will turn the program over to you now, Joani. Thank you.
You're welcome. Thanks, Melinda. And they tried to get rid of me at the Office on Aging, but, I said, nah, I probably have a few good years left in me. So the Safer Homes program is a program that builds wheelchair ramps for individuals that really can't afford to hire someone to build it. And we use volunteers to provide the labor, and we have funders that provide the funds for the materials. So that's going great, and it's a focus program, so I leave all of the other things to Teresa now, and it's great. So today we're going to talk about Medicare, the changes for 2023, but first we're going to review just the basics of what the program is about. So I have a PowerPoint here, and we are going to talk first about open enrollment. Open enrollment is from October 15th to December 7th. And now is the time that you need to review your coverage for either your supplement, your drug plan, or your Advantage plan, and make sure it's what you want for the following year. Because after December 7th, it's a little more complicated to change. We're going to start with just the basics. What is Medicare? It's health insurance for people who are over 65, or they may be under 65 with a disability, and they are eligible for Medicare after their 24th month of disability. And also those with end-stage renal disease and ALS is another factor that would put somebody on Medicare at a younger age. I really encourage you, if you don't have the Medicare and You book, I would either come to the library, they have a few books here, or you can access it online. But it is very informative and can provide you with a lot of the answers that you seek. And you can request that a copy be mailed to you also through the Medicare website. This is the website that I encourage you to use. There are a lot of imitations out there. This is the only official website for Medicare, and this is updated as changes take place, so it's offering the latest information. And it also provides comparisons, especially for drug plans. So you can put in your drugs that you take, your prescription medications, and it will compare plans for you and the costs of each. And the website will also offer or answer frequently asked questions. Many of us have the same question. So the basic thing to understand is that Medicare has a wide range of coverage. However, it only covers 80% of whatever is approved by them. So the other 20%, that total health care coverage, that is something that you either have to budget for each year, or you have to come up with a way of advantage plan or a supplement that will help pay that 20%, because that is for some people 20% is a lot of money. If you're in the hospital, it could be $10,000 or $20,000. So it's important to know that Medicare covers 80%, original Medicare. So then you have to look at options. And we'll talk about the options a little later. The page numbers that are listed in the slides are from the Medicare and You book for 2023. So you can refer to them in detail. I've just got the bullet points up here, but there's great explanations for everything that I'm going to cover. You have 3 months before your birthday month, and 3 months after your birthday to enroll in Medicare. And the coverage begins based on your enrollment date. If you don't sign up for Medicare when you're first eligible, it could cost you more for the rest of the time that you're on Medicare. So there's a penalty for Part B if you do not enroll when you're eligible. The only reason you would avoid that would be if you have coverage through an employer and that coverage is equal to Medicare's coverage, then you will not be penalized. What that requires is a letter from the employer when you end that coverage. You need to have something to prove to Medicare that you did have creditable coverage in order to not be penalized. You're automatically enrolled in Medicare at 65 years old if you're on Social Security or if you've been disabled for 24 months. If you're still working, which many of us are at 65, then you sign up online at www.ssa.gov, which is the Social Security website. That's where you will sign up and you will arrange. Usually you would pay for your premiums quarterly, and usually it's done through a direct deposit from your bank or your credit union. And if you have special enrollment situations where it gets complicated, if you have an employer with a certain number of employees versus 10 or more or 50 or more, that's where the SHIP counselors can really help. And their number is on the screen for you to make contact with them. They're in Knoxville. And they will help you with any tricky situations. But these are the generalities. So if you're working when you're 65, you would sign up online. You can sign up 3 months before your birthday month, or 3 months after your birthday. Like I said, annual enrollment is October 15th to December 7th. You can change your coverage. You can go from one Advantage plan to another. You can go from original Medicare to an Advantage plan. You can change your drug plans. You can compare the costs, the networks, tiers, and the formularies. So each formulary has tiers of drugs. So the Tier 1 is like the least expensive. Tier 3 is something you probably can't afford. So it's really important to know the formulary of the drug plan that you're choosing. If you're staying with what you have, if you're happy with it, there's no changes in cost, there's no changes in the formulary, then you don't have to do anything. They'll just keep charging you and you'll keep paying. To change plans, you can do it yourself online. You can enroll in a drug plan online, or you can work with a professional insurance agent that specializes in Medicare. And there are many in our area that are very reputable. Any of them would be able to help you out. And even with my career and my knowledge of Medicare, I always do my own research and then take it to a professional and see if that person agrees with what I think. So that's a good way to do it. Do your own research and then take it to someone else. They are very knowledgeable people. That's all they do. So there's two versions of Medicare. There's Part A. So this is where it all gets confusing. So there's Part A, which is hospital insurance. Part B, which is your doctors going for doctor visits. And Part D is for drugs. D is the easiest one. D is for drugs. And then you can buy coverage of a supplement, a Medicare supplement, or sometimes they're called Medigap, just to make things more confusing. I always refer to them as supplements because it's easier to just keep that in mind. It supplements that 20% that you're going to owe. So, and there are many companies that sell supplements. So Medicare Advantage plans are called Part C. They usually include, they always will include Part A and B. Most of them include drug coverage, which is Part D. They also now provide optional extra benefits like some dental, some vision, some fitness plans. And so it's important to shop around, but you have to know what you're looking for. Now we're going to talk more about, we'll just focus on Part A for a while. You usually don't pay a premium for Medicare taxes if Medicare taxes were paid while you were working 40 quarters, unless you are above $97,000 in income per individual. You can buy Part A as an option, but you also must buy Part B and pay premiums on both of them. So you can't just buy the hospital insurance. You have to buy hospital and doctor together. Right now, Part A costs $278 per month for those who haven't had 40 quarters of work. They've had 30 quarters, maybe they have 35 quarters. They can still buy the hospital insurance, but it's $278 a month. The hospital insurance includes all inpatient care, skilled nursing facility care. It does not include, and people, this is where people get confused. Long-term care, in other words, nursing home care, is considered custodial care, and it is not covered by Medicare. So any long-term care in a nursing home that is not connected with an individual hospitalization is not covered. And a lot of people don't know that. They think Medicare covers everything, and it does not. Hospice is covered through Part A and home health care. So your Part A will, if you had a hip replacement and you had 2 weeks of registered nurses coming into your home to do care for you, that would be covered under Part A. Now, all of these terms that I'm talking about when I say co-payments, co-insurance, or deductibles, those are all described in the Medicare and You book. So it's at the very end, and I've got a slide here that tells you where to go to look for the definitions, because they're kind of confusing. And it's important for you to understand that, especially if you're looking at a Medicare Advantage plan, where they talk a lot about co-payments, co-insurance, and deductibles. And it's important that you know what that means. It's also important to know whether you're an inpatient or an outpatient at the hospital, because sometimes Medicare won't pay if you're not considered an admission, if you have not been admitted. It's very important that you know before you get into a hospital room whether you're admitted or you're under outpatient status. That could be very expensive if you didn't know that. So inpatient hospital care has a deductible of $1,600 a year and no co-insurance for days 1 through 60. Oh, this is where I say about the definitions. So a benefit period. If you look on page 115 of Medicare and you will see 2 pages of definitions, and that's one of them, is a benefit period. So a benefit period begins the day you're admitted into the hospital or a skilled nursing facility and ends not when you're released, but 60 days later, if you have not been hospitalized again. So that's really important to know. The co-insurance for days 61 to 90 are $400 a day. So it adds up really quickly. And that's where when you talk about purchasing either an Advantage plan, be careful of what it covers when it comes to these costs, or a supplement that would pay probably most or all of these costs. So it's important to pay attention to the fine print. Inpatient versus outpatient is ordered by the doctor, and the status affects what you pay and whether you can qualify for skilled nursing facility coverage. So you need to be notified. You're required to be notified by the hospital if you're under observation for more than 24 hours. And that's on page 28. It explains that even more. But it's this hospital and inpatient and admitted, that's all really important for you to know if you end up in the hospital, to be able to protect yourself financially. So skilled nursing care would be in like Morning View, transitional care, or there's a number of them around that offer transitional care, and you are covered for the first 20 days of the benefit period, and then it's $200 per day for the 21 through 100 days. And after 100 days, if you're not better by then, you better be prepared, because it's going to be very expensive. And that applies to each benefit period. And then I again want to stress that long-term care is not covered. So skilled nursing care, what that means is you have to be improving. So the co-insurance of $200 per day is if you continue to improve. Say you had a hip replacement and you have to rehab that hip, and it's the therapists at the skilled nursing facility that are going to be determining whether you're improving. If you quit trying, then you're not going to be able to stay. So that's important to know, that you have to put you have to improve in order to stay for those up to 100 days. So hospice care is especially important, and it's covered by Part A, and not enough people take advantage of it in East Tennessee. So I really want to stress the importance of this care. It's a terminal diagnosis determined by a physician, and what it is comfort care. Instead of curing you, it's going to make you comfortable for the last days that you're on this earth. Usually it's provided in your home. It may be in a nursing home if you are unable to be sustained in your home. Provides medical care, nursing care, social services, provides the drugs, some of the medical equipment that are needed, and it's all brought to you, so you don't need to leave your home. Afterwards, after a person is deceased, there's a year's worth of grief counseling for that family. There's homemaker services that are provided. There's volunteers that come and visit. So if you get that terminal diagnosis, or if you know someone who has a terminal diagnosis, really encourage them to take advantage of this covered service by Medicare. There are many hospices in our area. They're all very good, and the family would be very supported by being involved. So now we're going to switch over to the Part B of Medicare, and that's the key thing: medically necessary, doctor's services, mental health services, outpatient and home health care, preventive services, and durable medical equipment. The premium actually dropped this year. It was $170.20 or something this year in 22. In 23, it's going to $164.90. And there's a $226 annual deductible. And then you would pay, if you had no other coverage, you would pay 20% of the Medicare approved amount. Or your Advantage Plan or Supplement would pay some or all of that 20%. The key with Part B is you have to make sure that your providers are enrolled in Medicare. If they are not enrolled in Medicare as a provider, you will not receive any benefits through Medicare. So it's critical that you know your providers. Most of them are enrolled, but it's a good thing to ask. And there's a Medicare now finally is focused more on prevention. And so there's one annual preventive service appointment that everyone can have every year. I think that's something that most people don't take advantage of, and I think it's really important. If you're on Medicare, use that benefit to connect with your doctor and make sure everything's going okay. I think prevention is the name of the game. Here are the things that are not covered by Part A and Part B. And the thing that's frustrating for me is most older people need vision help and dental help, and those are the two things that aren't covered. I think that in the future, if things go well, eventually they will be covered. Hearing aids are not covered. At least now hearing aids can be purchased over the counter, which really lowered the cost. But those are the things, and again, I stress long-term care in a nursing home is not covered by either Part A or Part B. And then sometimes a doctor will opt out of an item, and so of something that would be covered normally, but the doctor will opt out of it. So you should be informed of that prior to any billing coming your way. Acupuncture now is covered. It wasn't before. So we're moving in the right direction. Part D is for drugs. You must have Part A and B to enroll in a prescription drug option. So the drug plans are run by private companies that are Medicare approved. And they are for prescription drugs only. You can buy a separate plan. If you have original Medicare, you would buy a separate drug plan. Or many of the Advantage plans now come with drug coverage. Part D also has a penalty for late enrollment. Where this comes into play is if you're 65 and you don't take any prescription drugs and you think, well, I don't need a drug plan because I don't take any prescription drugs. And I always tell people, just pick the lowest cost drug plan that's out there, because you never know, next week you could need 5 prescription drugs. And it's better to have the coverage than it is to try and get it when you're paying more just to have the policy. So I encourage people, even if you're healthy, you think you're never going to need prescriptions, to enroll in a low cost. Some of them are even no cost for a drug plan. They don't provide a lot of coverage if they're no cost, but at least you would have some coverage if something would happen to you. So as I said, you can buy a standalone prescription drug plan, or you can buy a Medicare Advantage plan that has a drug plan incorporated into it. The thing with Part D and Advantage plans is you must live in the service area of the plan. So that comes into play if you buy a plan here and you move to Memphis or you move to Kentucky. You're going to need to change your drug plan, and that you can do that that would be a reason that you would have a special enrollment period if you moved. But most people don't understand that your friend in Florida who has this great Part D plan, you can't probably buy that here because it's not available. They're regional plans. The cost of the Part D is going to depend on many variables, and many of the drugs you take, you need to make sure they're in the formulary of the plan you're looking at. If they're not in the formulary, you're going to pay the cash price for them. So it's really important to review that, and we'll talk a little bit about that in a second. But you can do that through Medicare.gov. It's very easy to do. So now we're going to talk about Medicare Part C Advantage plans. This is what most people are used to. So our employers, when they give us insurance, most of the time, we don't have a say. We are given our insurance coverage, and that is what we have. It's a very slick trick that when you turn 65, all of a sudden you have to choose which coverage you want when you've never had the experience of doing it in your whole life. So an Advantage plan is most similar to what we're used to through our employers. And it's a plan managed by Medicare-approved private insurance companies. There are hundreds of private insurance companies, and I swear they're all offering Advantage plans. The Advantage plan must include all benefits and services covered under original Medicare Part A and B. Okay, so that's important to know, that you're going to get exactly the same coverage as you would in original Medicare. And it usually, right now, most plans include Part D for the drugs. The thing that Medicare has allowed the private insurance companies to do is to begin offering extra benefits and services. So they'll offer dental coverage, some dental, some vision, a fitness plan like silver sneakers. And if you can use those benefits, then by all means consider a plan with those in them. But don't just pick a plan based on the fact that they have those options. Consider the big picture. That would be more helpful. And the thing with Advantage plans is they usually require that you choose providers within their network. Most of them are HMOs, health maintenance organizations. And that's where if your doctor isn't in the network, then you either pay a higher cost to go to that doctor or you have to switch doctors. So that's the disadvantage of Advantage plan, is the having to choose. So you can buy an Advantage plan if you have Medicare Parts A and B, you live in the area where the plan is offered, and you don't have end-stage renal disease. So ESRD is an original Medicare coverage. Most common types of plans are the HMO, which is a network, a preferred provider, which means you can go anywhere, but it's more money if you don't go to one of theirs that they have as a preferred. And then special needs programs are for special groups of patients. And in some areas, and these pages might not be right now that I look at them. So just go to your Medicare and U-Book and look up HMO and it'll take you to the right page. But a private fee-for-service is also available, but not so much in East Tennessee. So questions to ask. When you choose an Advantage plan, you're going to pay that $164.90 or whatever amount that was, $164 and change. You're going to pay that premium in addition to whatever the Advantage plan charges. So that if you're on Social Security, you're going to have that $164 taken out of your Social Security check, and then you'll also possibly be paying for an Advantage plan on top of that. So essentially what Medicare does is give your Medicare money to a private insurance company to manage your care. That's what's happening. And so there may be an additional premium besides your Part B. You want to know if there's an annual deductible besides the deductible for Medicare. Is there more of a deductible? How much do you pay each time you use that plan to go for a visit or receive a service? You want to know what is the maximum you're going to pay out of pocket for the entire year if you choose that plan. Now, all of these questions can be answered by using the Medicare.gov website, by choosing Advantage plans and comparing them. You can compare, I think, up to 5 plans at a time. And it's usually pretty obvious which ones are going to be the best for your situation. And it's going to be based on your prescription drugs and how often you see the doctor and things like that. So the important things to know about Part C, and actually about all of Medicare, is you have a right to appeal a decision. So if Medicare denies a payment, you have the right to appeal that. You have the right to check in advance whether the service that you're going to receive is covered. Most of the time, the medical office will do that for you. If you're going to be out of network, you need to be sure you know what that cost is going to be. The other thing that's important to know is providers can join or leave plans at any time during the year. So you could start out the year with Dr. Smith, who's in Medicare in this network for a Part C plan, and then he says, I don't want to do this anymore. If you lose that provider, then you're going to be paying more if you stay with that doctor. So Part C is really the most complicated, but sometimes it really works well for people, so it's worth considering. The key thing with Medicare Part C is there's a limit on out-of-pocket costs with Part C. So they have a limit. It's high, but at least it's not sky high. And it'll include fitness and wellness benefits most of the time. It'll be silver sneakers or a gym membership or something like that. But if you never go to the gym and you don't care about silver sneakers, then I wouldn't worry about having that included. So a change a few years back was that if you decided on a Medicare Advantage plan during open enrollment and you used it or tried to use it and really did not like it, it wasn't meeting your needs, you now can switch to another Advantage plan. You can do it one time between January 1st and March 31st. Or you can disenroll from that Advantage plan and go back to original Medicare and a drug plan. But you can't switch from original Medicare to an Advantage plan or join a drug plan during January 1st through March 31st. So you're locked in if you're in original Medicare. But I think this is helpful. It's less nerve-wracking for people to know that if they really don't like this plan, they can switch. And keep in mind, there's no out-of-pocket maximum for original Medicare. The only way you would have a maximum is if you have a Medicare supplement in place. So that's something to keep in mind. Now we're going to go into supplements. I just call them supplements, but some people call them Medigap plans. They're sold by private companies. They're sold by Farm Bureau, AARP. They're sold by companies you've never heard of. And the thing about supplements is that every coverage, so if you buy an A plan, so all the choices are by letters, so A, B, F, G, H, whatever. An A plan is going to always be the same coverage no matter what company you buy it from. That's really important for people to know. So you don't have to be concerned about where you buy it, like an Advantage plan where one company is going to give you more and the other one might give you more cost or less coverage. Supplements are all the same. So it's designated by Medicare. It covers some or all of the remaining healthcare costs for Medicare-covered services and supplies. The thing that some people don't understand is that if Medicare does not approve a service, your supplement won't pay it either. So it's not like a secondary insurance like normally. These are linked tightly together. So if Medicare does not approve an expense or a service, your supplement won't pay either. So that's important to know. That's why it's really important to know whether you're going to have a Medicare approved service or supply. The other thing is supplements only cover one person. So you have to have, if you're 2 people in a household, you have to have 2 plans. It's another premium in addition to your Medicare premium. You cannot have a supplement with an Advantage plan. Okay, so those are 2 separate entities. So you can have original Medicare and a supplement and a drug plan. Or you can have a Medicare Advantage plan, but you can't mix and match. The choices are listed on pages. The definition and all the information is pages 75 to 78. I would really encourage people, if you're looking at a supplement, to compare plans, because some plans cost $100 more a month than the other, and it's the exact same coverage. So this is the one time when shopping around really pays off. And most of the time, what I would recommend if you're looking at a supplement plan, I would definitely go through a professional who is a broker and sells a number of different plans to compare the costs. You can do that online, but you have to deal with each insurance company separately. So it's kind of a hassle where if you go to a broker, they will have access to all the information on a lot of different companies at one time. And it seems to go a lot more smoothly. So, like I said, you can get your Medicare coverage 2 ways. You can do original Medicare, which is Part A and B, that's hospital and doctors. You can buy a drug plan, and then if you want, you can buy a Medicare supplement policy. The second way, okay, we're going to go back. So this is still original Medicare. You can go to any healthcare provider that's enrolled in Medicare and accepting patients. That's another key thing. Some of the doctors around here are not accepting new Medicare patients. So that's another thing to keep in mind, especially if you're new to the area. You need to locate a primary care, somebody who is going to be your medical provider. Sometimes it's not that easy. Except for a few instances, for example, chemotherapy, prescriptions are not covered. There's no need, you don't have to identify a primary care physician, and you don't need a referral to see any specialist, but the specialist must be enrolled in Medicare. And generally, the deductible, coinsurance, copayments apply in addition to the monthly premium, unless you have a supplement. And that supplement can either pay all of that or some of that, depending on which one you choose. Now we go to the second way. So the second choice, so you have original Medicare, Part D and a supplement, or you can choose a Medicare Advantage plan. Most of them also include drug coverage, so it's kind of a wraparound thing. But if they do not have drug coverage included with the Advantage plan you want, you would have to buy a drug coverage plan also. So how does Medicare work with other insurance? The key thing that I tell a lot of people is talk with your benefits coordinator, if you have employee coverage, go to HR, talk to a benefits coordinator or your union rep, and find out how that works, how they coordinate with Medicare, because it's different depending on how many employees are at that business. When you have retiree insurance, Medicare usually or always pays first, and then your retiree insurance would be secondary. And that's the only time that possibly something that Medicare refused to pay, your retiree insurance may approve, but I wouldn't bank on it. I would ask first. So what plan is right for me? These are just general guidelines. You might want Medicare plus a drug plan and a supplement. If you want to choose your doctors, you go to a doctor in Nashville or you go to a doctor in Chattanooga. You visit doctors frequently. You have some kind of a chronic medical condition where you are seen regularly. You travel extensively, or you have a second home in another state. If you have a second home in another state, original Medicare will cover you wherever you are. But if you have a Medicare Advantage plan and you are in another state that is outside the service area of that plan, it gets very complicated. So I would encourage somebody with a second home to just consider a Medicare and a supplement. If you have a supplement, what I like about supplements is it's predictable. So I know, okay, I'm going to pay this much per month, and then I know all my medical care is going to be covered. I don't need to worry about a hospitalization or going to the doctor or whatever. So some people, it doesn't matter, but to others, it's a peace of mind to know that it's predictable. I'm paying this and I'm going to get this. So some people, that really makes a difference. And there's about 30 different companies in our area to choose supplements from. And there's probably the same for drug plans. There's a lot of choices. There's probably too many choices. So a Medicare Advantage plan might make sense if it doesn't matter what doctor you see, whether if you want one plan, one premium like you've been used to your entire working life. If you don't go to the doctor very often or hardly ever, and when you go, you don't mind paying a $30 copayment. If you want lower premiums, so the premium on an Advantage plan would be considerably lower than a supplement. And if you needed that care, you would be sharing a higher cost. But upfront, you'd be paying lower premiums. If you don't mind comparison shopping for plans every year, because that's where Advantage plans will change. And if you're on one, I really encourage you to read the materials that you receive from your plan and make sure that you know what you're buying. If you want the options beyond what Medicare provides, like the fitness benefits, some of them you can buy $50 a month worth of over-the-counter meds through the mail. There's all sorts of different options. There's dental, there's hearing. If you want those, then an Advantage plan would make sense to you. And if you want that out-of-pocket maximum per year, you know the most you would have to pay is X number of dollars. So there's about 14 plans in our area of Advantage plans to choose from. So if you're unhappy, like we talked about, you can change from January 1st through March 31st. And you can go from an Advantage plan to another Advantage plan or to original Medicare. You can't switch from original Medicare to an Advantage plan until the following year's enrollment, open enrollment. Here's the big changes. The insulin cost has been capped at $35 per month. There's a large group of people that worked very hard to make that happen. And your Part D deductible doesn't apply to insulin, so you don't have to spend $200 first to get the $35 per month. The premium went down, like I mentioned. The adult vaccines are now covered. So shingles vaccines are now covered. They were very expensive. They are very expensive. And they're covered with no deductible. So finally, we're getting into progressive preventive medicine. And the other major thing is Medicare can negotiate with the manufacturers for some of the highest cost medications, and more will be added to that list every year. So that's really a very good change for us. We're the beneficiaries of these changes. So the special enrollment periods, I mentioned those a little earlier. They're covered on those pages in your Medicare and U book. If you lose coverage from an employee plan, so say you're fired, you quit, or you retire and you don't have that coverage, that would be a special enrollment period. Or if you move, or if you have TennCare and lose it, or if you qualify for extra help or lose extra help, and we'll talk a little bit about extra help. That's for Part D, for prescription drugs. Or if you're living in a nursing home, you may have a special enrollment period. Okay, so remember all that? There's going to be a test, and it's going to be how happy you are on January 30th with the coverage that you selected. But the simple thing is, do your homework and consider the cost of what you want, the coverage you're getting, and the convenience of what you're buying. Those are the three critical things to consider. Consider all the out-of-pocket costs, and the plan finders on Medicare.gov, they do this just seamlessly for you. So I would encourage you to get comfortable with using that. You can create your own account with a password and put in your drugs. You don't have to do it every year. And then if you change anything or drop a prescription, you can edit it. But it's a really helpful website. I'm sure you could access it here at the library if you don't have a computer at home. And make sure that the extra benefits in a plan you're choosing are things that you're going to use. So here's the 5 biggest mistakes made. The first is to either sign up too early or too late. If you sign up too late, you're going to pay that penalty. I one time had a woman who was 85 and had never signed up for Medicare. So she had no insurance, and it was way too late for her. She couldn't afford the penalty. So it's important to, not only for you, but any of your loved ones, make sure they're signed up when they turn 65 or lose their employee coverage. Don't confuse a Medicare supplement with a Medicare Advantage plan. Just remember, original Medicare and supplements go hand in hand. Medicare Advantage plans on the other side of the table. Don't guess. Don't just pick it based on price. If you need help with prescriptions, don't hesitate to apply, and we're going to talk about that in a second. And reevaluate your coverage every year to make sure it's still what you need. That is really important. So Savings Checkup is a program out of the Office on Aging, and they help people enroll with benefits, 5 federal benefits that are available to most people who are low income. So if your income is $20,000, $388 or lower for one person, and you have less than $15,000 and $15,510 in resources, or for 2 people, those following amounts, then you can get help buying prescription drugs. And our staff at the Office on Aging is well equipped to help you do that. Don't hesitate to call them. They are in your corner and will help you get every benefit that you've earned by paying these taxes for your entire life. There's also help with paying Medicare premiums, and the 4 are QMB, SLMB, QI, and QDWI. They're described in detail on page 94, and the amounts that are listed here are for 22. They haven't announced the amounts for 23 yet, so usually they go up just a little bit. So you can earn a little more and still be eligible. These are 2 valuable resources if you need prescriptions to access and compare prescription prices. GoodRx has saved me personally hundreds of dollars. So it's really good advice to load those apps on your phone and check them out when you have to buy something. The SHIP office is in Knoxville. This is their 800 number. They are funded by the state of Tennessee and will give free, objective health insurance counseling to Medicare recipients. It's independent of any insurance company. They also will help you with billing problems, with complaints you have, how Medicare works with other insurance if you're having issues with that. Or they also, like our Savings Checkup, will help find ways to pay for healthcare costs. So pages 97 to 106 covers your rights as a Medicare recipient. You have a right to privacy. You have a right to answers. If you have a question, you have a right to Medicare covered services in an emergency. So if you are on an Advantage plan, you have an emergency in North Carolina, you have a right to Medicare covered services. You have access to your own personal health information. You also have the right to not be harassed by agents to enroll you in a plan, and that has become a problem again. So just know, I had a call yesterday, and I asked this person calling, how did you get my number? How did you get my number? And she finally hung up. So, I don't know how they got my cell phone number, but I was not happy. The main difference between fraud and abuse is fraud is intentional and abuse can be kind of unintentional. Those two waste billions of dollars of our tax money every year. And so what we appeal to everyone on Medicare to be conscious of what you're being billed, what Medicare is being billed for, making sure that what your explanation of benefits, it's called an EOB, and Medicare summary notice, whether they're accurately reflecting visits you did make and it wasn't somebody else that stole your Medicare number, or that a doctor is submitting fraudulent claims, or but it's a really big problem because healthcare is so expensive anyway, and when we waste that many billions of dollars every year, we're going to run out of healthcare. So ask questions, keep records of your services, and then usually you'll either get your Medicare summary notices, or your explanation of benefits will be either online through email, or you have to log in to Medicare and look at them, or they'll mail them to you. Never ever give out your Medicare number over the phone or to some nice looking guy on the front at the front door who says, if you give me that, I will give you this. That is not how this works. The only people who need to know your Medicare number are your medical providers. Don't give it to anyone else. It's almost as bad as giving your Social Security number out. Don't accept, somebody will call and say, if I'll give you this for free. I'll give you a free walker, or a free this, or please don't fall for it, because it is definitely fraud. That is not how Medicare works. And we lose too many millions of dollars from our older people who are just scammed, and it breaks my heart. If you have a problem, you see an error, you detect fraud, there's a number in Tennessee for you to call, and please feel free to call it and report anything. They will help you. They are friendly people there. They're in our corner. So here are the best sources of information: Medicare.gov, the Medicare and You book, the SHIP number. I didn't put our number up there, which is really a disgrace. Let me just tell you that the savings checkup number is 865-724-1219, and they are there to help you 8 to 4, Monday through Friday. And those are some of the other numbers. AARP is a wealth of information for anyone looking for specific answers. If you have questions about anything that I've covered this afternoon, please feel free to email me, and I will give you an answer or a source that you can investigate on your own. So thanks so much for listening, and we will wrap this up.
Thank you so much, Joani. I appreciate you so much. You take these very complicated questions and you sort them out and help detangle all these mysteries for us. So we appreciate that more than you know. And I also, again, want to thank Teresa at the Office on Aging, and Angela and Elizabeth and Malcolm at SHIP for their help with the program. And again, we just appreciate your resources so much. I thank you all so much for joining us for the program, and I hope you will take advantage of the resources which Joani has highlighted for you. And of course, here at the library, if we can help you connect with them or with some of these resources, we will be happy to do that. And please feel free to call us at 865-273-1428. So again, thank you so much to you, Joani, and thank you to everyone out there who's watching.